In the module 2, we are going to introduce how this ACE and trauma can impact on physical, emotional, and social health. After watching this module, you will be able to understand how the body responds to stress, recognize the signs and symptoms of trauma, review the short and long-term effects of trauma, childhood trauma, and chronic stress. Fortunately, stress itself isn't bad. Our body needs it for survival. When children experience a traumatic event, they don't always develop traumatic stress. However, when it is too much, it can be harmful to them. Our body system has hypothalamic, pituitary, adrenal axis, and sympathetic nervous system that control 3 different stress responses. First one is positive. So it briefly increased heart rate, stress hormone level to mild and moderate. But this is a normal response, helping to develop healthy coping mechanism. The next one is tolerable. It alters body stress response system by elevating stress hormone levels greatly, but it returns to baseline with the adopt support care from the caregiver. Without the support, it can turn into toxic, which is strong frequency, prolonged activation of body stress system without the adopt support from the caregiver. And this can be harmful for children. This is a visual aid to help understand how our body system responds to the stress. Stress can lead to a flight or fight states that increase blood pressure and heart rate, but with adopt support from the caregiver, it can be deactivated. However, again, without the support, a child can stay in the freeze state, and this can be a long-term effect. Trauma may lead to children to have behaviorally higher rate of engaging health risk behaviors such as substance abuse, tobacco use, sexual behaviors, and obesity. Psychologically, children can have somatic disorder, hallucinations, anxiety, obsessive compulsive disorder, depression, suicidal thoughts, and attempt. And they can also have limited access to medical care and higher rate of unemployment and premature deaths. This impact can be temporary, but it can also last beyond childhood. But some children, this impact can interfere with their daily life activities.
Now you may ask, what are the signs and symptoms of trauma and how would you address them? Well, unfortunately, each child responds to ACEs and trauma differently. So some examples of emotional symptoms that you might see might be that the child's fearful, helpless, or potentially terrified. Some examples of some physical symptoms may include increased heart rate, vomiting, or loss of bladder control. Now, it is important to remember that these are just some examples, and children who have experienced trauma have many different symptoms and signs. It's also important to know that young children react differently than older children. The common symptoms among infants and toddlers include eating problems, sleep problems, potentially separation anxiety, a language delay, aggression, loss of previously acquired skills, maybe they're easily startled or upset, while preschoolers may exhibit avoidance, separation anxiety, aggression, and irritable behavior during play, potentially frequent crying and or screaming, eating problems, and nightmares. Now, elementary school children may demonstrate anxiety, fear, guilt, maybe limited attention span during class, sleep problems, over or under reacting to physical contact, while teens and adolescents experience depression, decreased concentration, potentially eating disorders such as anorexia or bulimia, self-harming behaviors such as cutting, maybe substance abuse, high-risk behaviors, and potentially unhealthy sexual activity. Now I'm going to address some resiliency factors. In short, resilience is the ability to adapt to difficult situations. With that being said, the presence of protective factors at the child, family, and community levels can reduce the adverse impact of trauma on children. These factors may include the presence of a positive supportive caregiver. This might be at home, in the community, at school, children knowing that they're loved and cared for by multiple adults. Peer support and positive social relationships, effective coping skills. Can the child recognize when they are upset or at a heightened state and reach out for help? The ability to express themselves and seek support. So kind of going back to the previous one, good problem solving skills and an internal locus of control, which briefly means that the child feels that they are in control of their own destiny rather than their fate being largely determined by external forces. So we have just finished up module 2, the impacts of childhood trauma and stress. And now we're going to go into module 3, the role of therapists in trauma-informed care. Thank you.